Nick?
Yeah.
Hey, man. I'm Dr. Bauman. I think Dr. Powers mentioned I might be coming in. I'm one of the behavioral health consultants.
Yeah.
Okay.
Yeah, he did.
Great, great. You know, I was looking through your chart, and it looks like this is the first time meeting anybody from our behavioral health team. Is that correct?
First time.
Well, again, I appreciate you sticking around and chat with us for a little bit. So whenever I'm meeting with someone for the first time, I like to give a little overview of who I am and then what we'll end up doing today. So I'm a psychologist, and I work very closely with the medical providers and the medical team, such as Dr. Powers. And my goal is just try to help people improve health in any way possible. That means working with people on physical health things, such as trying to improve diets, exercise, sleep. If people are dealing with pain and pain for a long time, which it sounds like that's what we'll be talking a little bit about today. And then also if there's any kind of emotional or stressors going on, we look at the whole person. So we'll probably chat for about 15 to 20 minutes. I'll ask you some questions to get to know you a little bit better. Then we'll come up with a game plan to help you out in any way possible. Some people get what they need out of one visit. Other people come back to follow up to learn additional skills. It's whatever you think is needed. And then after we get done chatting today, I'll check back in with Dr. Powers, let him know what we're working on, and then also put a note in your medical chart. Does that sound all right?
Okay.
Okay. Before we jump into some of the specific questions, I wanted to do a quick questionnaire with you. And this is kind of a quality of life measure just to see how things are going on overall. So I'll give you this. You don't have to fill out anything. It will just help you follow along with the questions that I'm going to be asking you. And for the first 7 items, I'm going to say the statement, and then you're just going to respond, yes, that statement describes me exactly. It somewhat does, or no, that doesn't describe me at all. Sound okay?
Sure.
Okay, so for instance, the first one is, I like who I am. Does that describe you exactly, somewhat, or no, not at all?
Somewhat lately with all the pain, somewhat.
Okay. I am not an easy person to get along with.
Not lately, that describes me exactly.
Okay. I'm basically a healthy person.
Used to be, I'd say, not now, no.
Okay. I give up too easily.
I don't give up, I got fight.
Oh, I like that, I like that. I have difficulty concentrating.
Only when I'm really in pain, just somewhat.
Just somewhat, okay. I'm happy with my family.
I don't know if they're too happy with me. I would say maybe somewhat.
Somewhat, okay. I'm comfortable being around people.
Somewhat. Not when I'm hurting.
Okay, and I can tell you're hurt, so I appreciate you allowing me to come in today to talk a little bit more. So now we're going to, for the rest of the responses will be none, some, or a lot. Okay, and today specifically, how much physical trouble do you have walking up a flight of stairs?
A lot.
A lot, okay. Again, today specifically, how much physical difficulty would you have running the length of a football field?
Not possible.
Not possible, all right. Now, over the past week, how much difficulty have you had with sleep?
Say some.
Some? Okay.
Yeah.
Again, over the past week, how much difficulty have you had with hurting or aching in any part of your body?
A lot. That's what I'm here for.
Exactly. I think we're going to spend a lot of time on that. Again, over the past week, how much difficulty have you had with getting tired or fatigued easily?
Some.
Some? Feeling depressed or sad over the past week?
Some, I guess.
Some? Nervousness?
Not really, no.
Okay. During the past week, how often did you socialize with other people, such as friends or family members?
Not the last week, not with this kind of pain.
Okay. So we would say
people.
We'd say none.
Yeah, none.
Okay. A similar question, but a little bit different. Over the past week, how much time have you spent doing social activities? Like that would be going to meetings, movies, church, sports, parties?
Nothing.
Nothing. Okay. And during the past week, how often did you stay at home or in a hospital due to being sick, injured, or having another health problem?
Pretty much every day.
Okay.
5 to 7 days.
All right. So let me show you what this gives us here. So this gives us some scores on certain life areas that we like to look at, and we usually look at the first 4 of physical, mental, social, and general health. Now, the best you could do on any area is 100. The closer you get to 100, the better. Anything over generally 70, we think you're doing decently well in. So obviously physical health, and as we said, we'll talk a little bit more about we're picking up on a lot of things, not only the pain that you're experiencing, but also sleep and fatigue that's been going on. Mental health, not doing too bad, which I gotta say is pretty impressive. Everything that's going on, it's at a 70, and I think it's a really great sign to see that even with the physical pain being pretty high, we're doing okay mental health wise. Social health, and it makes some sense, it's a little bit low at a 20, and then general health is about a 37. So if you come back in, we'll do this again just to see if there's any kind of changes or improvements, and we'll track it over time. Sound all right?
Sure.
Okay.
Sounds good.
All right, so let's jump in here. Again, I'm going to ask you some questions just to get to know you a little bit better. Currently, right now, who do you live with?
Well, I live with my wife.
Okay.
And got 2 teenage kids.
2 teenage kids.
Yeah.
So besides wife, teenage kids, anybody else in the house?
No. Father-in-law comes over sometimes.
Okay. Okay.
Yeah.
How long have you been married?
About 15 years.
15 years.
Yeah.
Overall, how's the relationship doing?
Well, I know she loves me, but this pain's been hard for both of us. So, not we have our good times, we definitely have our bad times.
Absolutely.
Lately, not so good.
Yeah.
Yeah.
You know, and here's the thing. I'm sure as we talk about different things today, I can see in your face, again, this is tough. And not only just dealing with the pain, but the impact it seems like it's having on the family. I can't imagine how tough that has to be for you. So I appreciate your honesty and even saying that right now. So it seems like, again, married for 15 years, but this pain has definitely taken a toll on the relationship. Do you two get to do any fun things together still? Any activities that you're still engaging in?
Oh, when I'm feeling all right, we do. I mean, we like to go out to movies and.
Seen any good movies lately?
Not lately. Not the way I've been feeling.
Okay.
It's been a while.
Okay. Now let me ask you. You mentioned 2 teenage kids. Boys, girls?
One of each.
One of each. All right.
Mm-hmm.
How are they doing?
They're all right. They're pretty good kids, but I think they can tell I'm not doing so well. I think they're kind of worried about me.
Right. And again, similar to the relationship with wife, that seems like it impacts you, but having them worry about you.
Oh, definitely, yeah.
Okay.
Definitely. Nobody wants their kids to be worrying about them, and you're their parent. You're supposed to worry about your kids, not the other way around. But
That's a heavy thing.
yeah.
Okay.
Yeah.
Outside of the immediate family of wife and 2 teenagers, anything else? Any other family in the area?
Well, I got the father-in-law, like I was saying, who's around.
And he comes over a little bit, as you said.
Yeah, every once in a while.
Okay.
I kind of wish he wouldn't, but he does. I got a brother. I got a sister.
Okay.
We haven't been talking so much lately.
Are they in the area?
Yeah, they're about a half hour away.
Okay. Any reason why lately just not talking as much?
I don't think they really understand my situation.
Okay. Okay.
Yeah. They don't seem to get this pain thing, which most people don't, I mean, I didn't have this for a long time, and, so, but yeah, they think I should just, I guess, just suck it up and go back to work or whatever. I don't think they quite get it, though.
Right. And I can only imagine how much you would like to be able to do that as well.
Heck yeah.
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 Anyway. Any other family, parents around?
No, they're a long way away.
Okay.
Yeah.
Okay. Any friends in the area? Social relationships outside of family?
Not really. We got friends, and I talk to my neighbors sometimes, but most of my friends, I don't know. I'm not sure how much they get it either, frankly, and plus everybody's busy, and so I don't see friends too much.
Okay. And it sounds like since the pain, and especially since it's been increasing, that's gotten in the way of friends. Were you social before?
Yeah, we used to be more social. We used
Okay.
to do things with the neighbors more. We'd have people over for dinner when I'm not driving.
Okay.
I'm a truck driver, so.
Okay.
Or at least I was.
Mm-hmm.
Don't know if I will be again, but yeah.
Okay.
I mean, we used to do more.
You used to do more.
Mm-hmm.
So you mentioned the truck driving. How long have you been driving truck?
Whole life, pretty much.
Yeah.
Yeah.
Okay.
Yeah.
And how long ago has it been? Are you currently still driving truck, or are you off
No
work?
way, no way.
Okay.
No.
How long has it been?
I haven't driven a truck for 2 years.
2 years.
Yeah.
Okay. And again, we're going to get to kind of what prompted the pain in a little bit. But 2 years driving truck. Did you haul to other states, or was it more local that you drove?
No, I was going cross country.
Okay.
I was going
Whatever.
a long time sometimes.
Okay. Any hobbies that you have? Anything you like to do for fun?
Well, used to play softball.
Okay. What position you
Definitely
play?
out. Pitcher.
Nice. Nice. Okay.
Definitely don't do that. Like to play cards.
Okay.
You know, every once in a while we do that.
How often
with
would
my
you say you
friends.
play cards?
It's been a while.
Okay.
Been a while. Like I say, I don't see people too much.
Since yeah.
Yeah.
Okay. Okay. Would you define yourself as a spiritual person?
We go to church occasionally.
Okay.
If that's what you mean.
Okay. Would it be a weekly attendance, or how often do you attend in church?
Nah, I haven't been to church for 6 months.
6 months. Okay.
Yeah, the wife goes.
Okay.
You know.
And again, thing getting in the way of going to church, pain?
Yeah.
Yeah. Okay.
Yeah, pretty much, and you know they always want you to come in, and they know that things aren't going well, and they want me to come in and talk to people, and you know.
It's bigger hassle than what it's worth.
Yeah, I feel like they don't really get. I got a physical problem here. It's not something that I'm going to talk away.
Okay, I'm with you. I'm with
Yeah.
you. Okay. So let me switch gears real quick and ask you some health-related questions. Do you drink any coffee?
Yeah, I drink a lot of coffee.
Okay. How much coffee would you say you drink in a day?
Probably 5-6 cups.
Okay. When's the last time throughout the day that you would have a cup of coffee?
There is no last time, really.
Just continuously throughout the day? Okay.
Yeah, when I need it, you know.
Okay.
I don't sleep so good, so I get tired, but I don't want to sleep all day, so I just have coffee.
Something that helps you keep up.
Yeah.
Any soda?
Nah.
Okay. Any energy drinks, Monster, Red Bull?
Nah.
Okay. Any teas, iced tea or hot tea?
No.
Okay.
Just coffee.
Just coffee?
Yeah.
Okay. Any tobacco use?
Well, I've been trying to quit. You know, I know Dr. Powers says I gotta quit. I know that. I'm trying. I'm down to about 5 cigarettes a day.
Dude, that's impressive.
Yeah, I used to smoke a pack a day.
Yeah, especially again with the pain levels, it seems like the way they are too. That's really impressive. Well done. You know, we might not talk about it specifically today, but you know, that's something we also help people with is quitting smoking, and it's one of the toughest things to do. And again, the work that you've already done to get down to 5 cigarettes a day, amazing. But if you would ever want any additional help, let us know, because that's something else that we might be able to help with.
Yeah, Dr. Powers said that too. I'll think about it.
Okay. Any alcohol use?
Yeah, I drink occasionally.
Okay.
Yeah.
How many days a week would you drink?
Honestly, I guess most days I do.
Okay. Were you saying about 4 to 5 drinks each day?
Yeah, I suppose so, if I'm
Okay.
being honest about it.
Yeah, I appreciate the honesty.
I know Dr. Powers said I gotta cut that down too,
Yeah.
but
So 4 to 5 drinks in a day. Is it all day, kind of like the coffee, or is it more just in the evening, in the morning? What time would you be drinking?
well, you know, I mean, I say 4 to 5 a day, but I can have days I don't drink anything.
Okay.
But then I have other days where I might hit it pretty hard.
Anything that prompts those days versus not the other days?
Honestly, it's the pain
Yeah.
mostly. You know.
Yeah?
Yeah.
Dang right.
When the pain is hurting.
And does the alcohol help with reducing the pain?
Yeah.
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 Makes sense.
Mhm.
Okay. Okay.
For a little while.
For a little, and
Yeah,
then
bit.
it comes back. But you get that brief moment of, yeah, okay.
Exactly.
Any marijuana use?
A little bit here and there, but you know.
Daily?
Not much. No, not every day.
Okay.
No. Wife wouldn't tolerate that.
Okay.
No.
Is that another thing that you're using for pain relief?
Yeah, but I know I can't do it that often, so that's why I drink more.
Okay. Any other drugs, cocaine, meth?
No, not
Anything?
for a long time.
Not for a long time.
No.
When's the last time you used?
Like 5 years ago.
Okay. Well, what
Yeah.
did you use?
Well, it was just occasional cocaine, I guess, but I had, a couple guys I knew who did it, but
Okay.
yeah.
Nothing.
I don't do that anymore.
5 years ago. Okay. Well
Yeah.
done. Again, impressive. How many times a day are you eating?
That kind of depends on the day, I guess, but most days I skip breakfast
Okay.
because I'm kind of trying to keep the weight down, which doesn't work so well.
It's tough.
But
Right.
yeah.
Yeah.
I eat lunch, I eat dinner.
Okay. So eating usually 2 meals a day, as you said, purposely skipping breakfast. So it's not that you're not hungry for breakfast, it's more trying to lose weight, so we're trying to skip breakfast.
Yeah.
Okay.
Yeah.
It's always a difficult question to answer, but those 2 meals that you eat, do you feel like you eat healthy?
I eat whatever we got,
Okay.
I don't cook really, so
Okay. Who's doing the cooking?
my wife does cooking.
Okay. I might come back to that a little bit later, but any exercise right now? Any physical activity?
No.
Okay.
I mean, on good days, I'd go for a walk.
Okay. How many good days are you having lately?
The last week, 0.
0. Okay.
In the last month, I've had a few. Go for a walk. I like to walk. I like to get out and do that if I can. My wife will go with me.
I was just going to ask, does anybody go with you? So wife goes
Yeah.
with you? Good.
Yeah.
Awesome. Beautiful, man. Again, something we might come back to. Last question, and as we talked about in the questionnaire, it seems like it's been a little bit of a trouble, but sleep. How many hours a night do you get into sleep?
I don't sleep good.
Okay.
No, I have trouble getting to sleep sometimes. Sometimes that's why I drink too. Kind of seems to help.
Help get you to sleep.
Yeah.
Yeah. Okay.
And then I wake up during the night. This back it just wakes me up.
And is that what's causing the problem of falling asleep too? Is the pain?
Yeah, pain, or I got things on my mind.
Mine's racing a little.
Yeah.
Okay. That's the thing that sucks about it. We're not good at shutting that off.
Yeah.
If
Yeah.
if we could, we would. Okay. So, in total, on average, how many hours do you think you get?
Some nights I probably get, I don't know, 3 or 4.
Okay.
Other nights, if I'm lucky, maybe I get 10.
Okay.
But yeah,
But on average, it's about in that 3 to 4, maybe a little bit more when you.
somewhere in the middle there, maybe.
Okay. Okay.
Yeah.
As we said, problems falling asleep and staying asleep. Has the sleep only been a problem for the past 2 years, or was sleep a problem even before the pain onset?
I never really had such problems with sleep before.
Okay. So it's
Really
definitely
been-
after the pain started.
Mostly.
Okay.
Yeah.
Okay. So let me ask you this. And the obvious question becomes, 2 years ago, the pain started. What caused the pain? What happened?
Beats me, I got all of a sudden, I started having this pain when I was driving,
Okay.
and it was a bumpy road. I remember. I don't know if that was making it worse. I did some bumpy road driving, but yeah, it just started hurting, and then nobody could tell me,
Right.
what to do about it or nothing. So
I can't
just
imagine
kept driving.
how frustrating. Again, what my mind tells me is like how frustrating that had to be. That you have this pain, no one can tell you what's going on. And it seems like, as you said, you try to push through it and keep driving.
I personally think it's the driving that did it to me.
Okay.
And I'm trying to get the L&I, and
Okay.
they won't give it to me, and trying to get disability, they won't give that to me, but because I think the driving did it to me.
Okay. Over the past 2 years, has the pain gotten worse, stayed the same, better?
It's getting worse.
Keeps getting worse.
Yeah.
Okay. And as you said, it seems like it also over the past 2 years has gotten in the way more of life as well. That it's gotten in the way of whether it be relationship with wife, children, friends, being able to play softball. It seems like it's getting in the way of more things.
I'd say that's true.
Okay.
Yeah.
Okay.
I don't know. My wife, there's a lot on her. There's a lot on her. So.
And what do you mean by that?
Well, I'm not working anymore. She's the only worker in the house, and she's got to do the cooking because I can't do that.
Gotcha.
I'm not in the best mood all the time, and so I don't want to go out and do things so much like we used to.
Let me ask you this, dude. You know, and again, I'm sitting here and my mind's going about just different strategies and different things that we could recommend to potentially help with the pain. But the one thing that just struck me there, as you were kind of just reflecting on that, of like the impact that it's had on wife, my mind immediately went to, you know, what are you feeling right now even talking about that? I mean, what comes up even just as we're having this conversation right now?
Well, it doesn't feel good, that's for sure. I feel bad about it.
Dude, I cannot imagine. Cannot imagine.
I feel kind of guilty.
Yeah.
I guess, but nothing I can do about it. I got a physical problem and nobody knows what's causing it, and you know, so I just got to figure out how to deal with it, I guess.
Yeah. And this is the thing that really kind of sucks about the pain, the chronic pain, right? Is that, one, just dealing with it in and of itself, just dealing with the pain is bad enough. But then what really kind of sucks is what our mind starts to do to us. Especially someone like yourself who's hardworking, tries to provide for the family, your mind becomes pretty critical of you not being able to do those things anymore. And again, I can't imagine how much that has to tear you up as well for it. So the thing that I was going to say is I definitely think there's some things that we might be able to talk about behaviorally that we can try to do. And in no way, shape, or form do I think this is going to take away your pain completely. And more importantly, I don't even know if we want that to be the sole judgment or the sole outcome, you know. Rather, maybe on having the outcome based on the things that you're doing, the things that you're engaged with, the things that matter most to you. But irregardless of anything that we do, the one thing, and I know this is corny as hell, and I'm going to set it up that way, the one thing we got to start to do is be kind to yourself. Because the truth of the matter is, if you could take away this pain, you would have done that a long time ago. This is a lack of trying. And again, our mind's beating us up all the time. That's a tough thing to handle every day. Now, being kind to yourself sounds great in theory. Sounds like, hell yeah, it would be great to be kind to myself. But my mind doesn't allow that to happen a lot. So instead of trying to think yourself to be kind to yourself, and again, this is the corny part, I wonder if we could do some stuff to actually act in a way that would be kind to yourself. I wonder if there would be some things that we can do to actually show that you're being kind to yourself. Kind of like if we were watching it on a movie screen, we could actually see you being kind to yourself because you're doing something. So let me ask you, if you were to do like an act or a behavior that would demonstrate that you're being kind to yourself on a daily basis, what could that be?
Well, I could tell myself not to feel guilty because I just got a physical problem.
Mm-hmm. Okay. So, if you told yourself that, if we were watching you on the movie screen and you were telling yourself and in the mind, what would we maybe see you doing? What would we see you behaving as? Would there be anything that you would be doing differently?
Well, I guess if I didn't feel so guilty, maybe I would actually just talk more with my wife. That would actually be, that would actually probably feel good to me.
Okay. Could you imagine, what would you be talking to? Or would it be at a certain time of the day? Do you guys usually have moments that you're able to talk, but you're not doing that right now?
Morning.
Morning? Okay.
And she's getting things ready.
All right.
For the kids and for herself, and I usually just sleep in because if I can, because I usually didn't get much sleep the night before.
You gotta get as much as you can.
You know, and I don't eat breakfast, but I see what you're saying. If I could maybe get up and maybe talk with them, talk with the kids, talk with the wife in the morning. I think they'd like that. That would probably feel good to me. So, is that what you're talking about?
Yeah, exactly. So it wouldn't just be wife, it would be the kids. It's the entire family to engage with.
Yeah, because the kids are there too. Yeah.
So here's the thing, and we know what's going to happen. This sounds great, but tomorrow morning is probably going to come, and I bet you're going to wake up and the pain's going to hit you. And it's just going to be like, can't get up. I don't want to get up.
That is the way it works.
Yeah, like
Yeah.
clockwork, right?
Mm-hmm.
So again, I wonder if this is that moment that we can show some kindness toward yourself, show some compassion toward yourself.
Mm-hmm.
And the way that I like to do that, and again, rather than trying to think it, I like to do a behavior that demonstrates that you're being kind to yourself, you're being compassionate toward yourself.
Mm-hmm.
So I wonder in the morning when the alarm clock goes off and you're about to get up and again the pain starts rushing in, before you go out to the room to talk, I wonder if you could have a brief moment of pausing, and again, this is going to be corny as hell, but to tap yourself on the chest and either say out loud or internally, I'm going to be kind to myself right now. This is that moment of showing myself grace. But yeah, I'm in pain. There's no doubt about it. And at the same time, I'm still going to go engage with my family because that's what means the most to me.
Mm-hmm.
So again, when you're waking up in the morning, to have that brief moment of tapping on your chest and either saying out loud or internally, again, this is that moment that I'm going to show myself grace.
Mm-hmm.
That yes, I'm in pain, and I'm still going to go out and spend time with my kids and my wife.
Mm-hmm.
What do you think? Can we try it out?
I can't promise I can do that every day, but
I like it. How many days do you think you could do? Because I agree, because we probably, since we're not really doing this right now, we don't want to set a goal that we're not going to accomplish. What do you think you could do? What's realistic? What's feasible?
I'll try it. I'll do it. I'll try it. I could do it a few days.
Can we say
do it.
2 days?
I was going to say more than that, but let's start with 2.
Okay.
Yeah,
2 days.
because I haven't done that for months.
That's what I'm saying. Honestly, bro, if you get 1 day, I'll be ecstatic. All right. So 2 days, I think, is a good goal. Even if it's 1, I think that's fine. But let's set the goal at 2 to try to do that. So, especially since this is something new that we're starting back up. Okay. The other things I want to give you is some education on chronic pain, and we're going to give you some handouts about just different things that, again, I don't know if are necessarily going to take away the pain completely, but might help bring the pain down a little bit, which might, again, cause us to maybe do some more things. And the information goes over specific diet things to do, because there's some foods that, as we eat more of these foods, they actually cause our pain to get worse. And then there's actually some foods that if we eat them more, they cause our pain to go down. So I'm going to give you that information. And then lastly, just some basic relaxation to go over. As you know, the one thing that really sucks about pain is that when you have pain, your body tenses up, which actually makes us more prone to have pain. So we have this horrible cycle of pain, tension, more tension.
I know what you mean. I got that right now.
Exactly. I appreciate you staying in the room.
Yeah.
So doing the relaxation might not necessarily do anything about the initial pain. The one thing that it will do, though, is help your body still not be as tense when that pain hits. So I'm going to give you some basic relaxation to do, and to do it daily, to help your body always get that constant signal of calm down, relax. Because we know the pain's going to be there, and we know the tension's going to follow. So if we can start to disrupt that a little bit. Okay? So I'm going to give you that information. I'm going to write down that goal for us to focus on again of 2 days a week, spending time with the kids and wife in the morning, that tap on the chest before you get out of the bed. All right? I know Dr. Powers is going to have you come back in a month. I wouldn't mind stopping in at that time to check in to see how you're doing, if that would be okay.
Yeah. Whatever you say. You seem all right.
All right. I appreciate that, man. And then at that time, maybe we'll talk a little bit more about the smoking to see how we're doing with that as well.
Could do that.
Sound all right?
Yeah.
All right, my man. It was good talking with you. I'll see you.